Hi, I'm Dr. Asha Yadav, Research Associate at the University of Oregon. Thank you for your interest in our research article. I'm presenting on behalf of my co-authors, Dr. Randall Allen Phillips and Dr. Jane Squires. Part C Early Intervention of the Individuals with Disabilities Education Act provides early intervention services to infants and toddlers with or at risk of developmental delays or disabilities. Under the federal regulations, children referred with developmental delays must undergo interdisciplinary eligibility evaluations. However, those referred with diagnosed medical conditions that have a high probability of developmental delays or disabilities automatically qualify for these services. Their eligibility is determined based on their medical condition and a review of medical documents provided by the child's pediatrician, which states the medical diagnosis and the need for early intervention services. To facilitate the enrollment of children with diagnosed medical conditions, the state early intervention programs provide established conditions list and procedural guidelines. However, there is limited understanding of how pediatricians and early intervention personnel utilize these established conditions lists and associated policies and procedures. Research shows that referral failure often results from poor collaboration between pediatricians and early intervention programs, as well as pediatricians' limited knowledge of the early intervention program. In this mixed method study, our primary aim was to examine the knowledge of the established conditions lists and associated policies and procedures among pediatricians and early intervention personnel. Our secondary aim was to examine the state initiatives undertaken to improve familiarity and utilization of these lists, along with recommendations for improvement. We collected surveys from 193 early intervention personnel involved in intake and eligibility evaluations and 69 general pediatricians. We also conducted interviews with 45 early intervention personnel and 22 general pediatricians. This study was conducted across Washington and Michigan due to their comprehensive established conditions lists. Our findings show that general pediatricians rated their knowledge of their state established conditions list and related policies and procedures lower than early intervention personnel. As shown here, for most items related to the state established conditions list, early intervention personnel rated between 4 and 5, whereas pediatricians rated between 2 and 3. Similarly, for items related to the state policies and procedures, early intervention personnel rated 5, while pediatricians rated between 3 and 4. With regard to state initiatives to improve knowledge and access to the established conditions list, survey findings indicate that 68% of early intervention personnel and 27% of pediatricians reported receiving some training either at work or during their academic studies. However, interview findings revealed that their training was limited in scope and the utilization of these lists in the referral and eligibility determination process was not adequately emphasized. And lastly, the key recommendations included distributing the list to pediatricians, including it in professional development activities and publicity materials, adding a reference to the list in the early intervention referral form, adding a disclaimer that the list is not all-inclusive, and incorporating other details such as brief description of medical conditions using pop-up windows, references to support organizations for the listed conditions, and adding aliases and ICD-10 codes. Given the importance of early identification and intervention for children with developmental delays and disabilities, we urge widespread dissemination of our findings and call upon primary care and public health partners, federal agencies, and national early childhood initiatives to incorporate established conditions list into their strategies for improving identification, referral, and linkage to early intervention services. Thank you.